We're now heading into week 4 of the pandemic, where now I am being called in literally 20 minutes before a shift is supposed to start because they need more coverage. It is now March 27th, 2 a.m. in the morning, and I just finished my 17th shift out of the last 19 days since I started working. It's day 3, week 5, third different emergency room, third different day, third different borough. You can see my battle scars has been mitigated by this do-it-yourself Band-Aid. Patients are coming in less often, but sicker. I'm going to take 2 days off, especially when everyone else are finding out that I'm working this much. So it's kind of like mandated. I should take a break for my sake and my mental health. ER number 4. But I am worried about how to fill in all those open shifts that's been coming in. This is war. It's not going to get any better if we call out.
Life may never be the same for our nation's healthcare workers, especially those who have been on the front lines of the coronavirus pandemic. Today, we are getting a first-hand account from ER doctor Calvin Sun in New York City, the epicenter of the outbreak, where nearly 9,000 people have died from COVID-19 at the time of this recording, including fellow doctors and nurses. Dr. Sun, thank you so much for joining us, and thank you for your tireless service.
Thank you for having me.
Now, over the last 5 weeks, you've worked at a dozen different emergency rooms throughout New York City, and you have chronicled your harrowing experience on social media, calling it a war zone. So what have you been seeing this week?
So this week is the tale of two cities, where downstairs in the emergency room, finally feeling the profound effects of social distancing and an actual lockdown. It takes about 2 to 3 weeks for that to take effect, and this is why there's so many fewer patients coming in this week compared to 2 to 3 weeks ago. That surge that you kept hearing about in the emergency room were all the people infecting one another before the lockdown was enacted. It takes about 1 or 2 weeks, 2 to 3 weeks at most, for symptoms to manifest after exposure. And that's why they overwhelmed our emergency room last week and the week before. Then the lockdown hits. That takes another 2 to 3 weeks. And that's why it's calm now in the emergency room. Upstairs, there's death and death and death. You hear cardiac arrest calls all the time. Those are the people we admitted 2 weeks ago during the surge, the people who were infecting one another before the lockdown. It takes another 2 weeks to get kind of sick. I need to go to an emergency room to get admitted, and the people who are sick enough to be admitted are the ones that probably will do worse, and goes from 2 weeks of symptoms to cardiac arrest, if not better, but most of them die.
And as the number of these new coronavirus cases appears to have plateaued in New York, and they're reporting that the number of new hospitalizations have slowed down, are you feeling a little bit hopeful at this time?
I think given our previous experience, once the lockdown will be lifted or people will break quarantine, and I'm a New Yorker born and raised, I know what it's like to be told not to do something and then rebel or question that. And all it takes is one other person, where other people will see other people outside and more people will come out, and the weather's nicer, and this encourages people to just take a chance. And then the surge will happen 2 to 3 weeks after that. And then we're going to have the cycle repeat itself until we have a working vaccine or a medicine that actually is proven to work, both of which will probably take a year to really figure out the side effects and risks versus benefits. Or we have herd immunity, which I think is ethically horrific, because that means you have to need enough people to die out, which I don't want to fathom. And I rather prefer waiting in and not lose too many lives unnecessarily.
Interestingly, you set your own schedule, meaning you get to pick up shifts whenever you want at various hospitals. So give us an idea of what the need has looked like for hospitals to find enough doctors to fill in these shifts. And how often are you working now?
So it speaks to the status of our healthcare system that I was able to make a living as a per diem only doctor ever since I graduated residency 2 years ago. I thought I had to scour the country looking for work, trying to put food on the table, pay off my student loans. I never had to leave New York City because there was always openings available. Every 4 to 5 days, I would get a text message or a phone call. Hey, I have jury duty, or I forgot my son's recital, or I'm sick. Can you cover for me? And I'm like, I'm happy to. And I would just come in because we had a shortage of doctors way before COVID-19. So what do you think is going to happen now during a pandemic where doctors are dropping out? So I would get a text every 4 to 5 days. Now I'm getting 4 to 5 texts per day. It's completely inverted.
And the need for us to get our hands around this crisis. And every working day, your shifts have been long. They're extremely dangerous, especially early on when you didn't even have the appropriate personal protective equipment, the PPEs. Tell us, how in the world did you manage during that time when you didn't have the right PPEs and just having to interface with the most critically ill?
For me, I just cobbled together whatever PPE I could find, whether it were plastic bags or old masks or borrowing for someone else. Like, we borrowed bleach wipes from other people because we ran out of bleach wipes. And I would say that I'm lucky, if lucky is even a word that I can use, to be per diem. I have access to different emergency rooms. So for the first 2 weeks, every day I was cobbling together a PPE from different emergency rooms to create my own de facto makeshift DIY Iron Man suit. That the first 5 minutes of every one of my shift in a different emergency room was like, oh my God, it's so cool. Where did you get that? And most doctors are full-time. That means they're only credentialed to work at that one emergency room they've been working the last 5, 10, 15 years. So they only have access to whatever that emergency room has access to, and they lack whatever that emergency room lacks. That's a problem because I'm one of the lucky ones. What about my colleagues who only have a mask? I've given up on looking for PPE. Like, it's just, forget it. Like, I have to take care of myself. And that's where I have now have my own PPEs. And I have my P100 mask. I have my special lab safety goggles my brother gave to me, my hard face shield that's permanent that EMT, my friends in EMS gave to me. Everyone's talking about N95 masks. You know, no one's talking about goggles and gowns and gloves and other things that are essential. We should be fighting for the 21st century. None of this even matters. We need PAPRs, positive air purifying respirators, that are $2,000 a pop, but they cover your whole face without any straps. They have positive air ventilation, battery powered for up to 8 hours. And you'll see it in every other country. Once you have a PAPR, you're golden. You just need to put on one thing and you're set. You don't have to take this 10, 15 minutes that I do to put on a hazmat chemical bunny suit without, infecting myself.
So I'm in one of the field tents that's being set up right now. It's at a hospital that's being overwhelmed, one of many. And essentially they are popping up all around the city. And when I'm not seeing patients on my day off, I'm helping in with setting up for mass casualty scenarios and telemedicine, so doctors who are remote inside the hospital can quickly assess their patients inside these tents.
And as an ER doctor, you've already been trained to deal with the worst of the worst. I mean, do you really feel like you were ready for this?
Nobody's really ready for a pandemic. Otherwise, we wouldn't be in this position in the first place. Mm-hmm. But we signed up for this because we wanted a career where we're ready for things that we're not ready for. Mm-hmm. That we're comfortable with being uncomfortable, that we are set up for mass casualty and disasters. I mean, it's defined as a disaster because, what defines disaster is that the amount of patient care overwhelms the amount of resources available, that you were not ready for it. The resources were not made ready for the amount of casualties that are about to come in. And that's why it's a disaster. And people who train in disaster medicine, I signed up for never being ready and deriving some order out of chaos on a constant basis. That is how I live and that is how I work. I understand how difficult it is to self-quarantine and shelter in place against an invisible enemy. It's bizarre. There's no tanks rolling down the street. There's no foreign paratroopers running down the street. So when the government says shelter in place, when there's a war going on, everyone can see, there are tanks going down the street. I exactly know why I need to shelter in place and hunker down. But with a virus, you can't see it. Everything's contained in hospitals and emergency rooms. So people kind of question, like, everything looks, safe and the weather's getting better. What are we sheltering in place for? And if I can provide some kind of consumable content for people to truly understand, whether it's for my words or my emotions or the things I show on my social media, people can better understand why they're sheltering in place. It's the why aspect, to explain something so that people then, when they question an order, they can choose for themselves rather than being told what to do, what the right thing is.
And to that point, there is a lot of talk now, right, about the loosening of the social distancing measures and reopening the economy. And we're also seeing protests around the country to lift the restrictions. What are your thoughts on that?
I can't tell people what to do with their free time. I don't really want to waste too much of my time with, on people who have too much time to waste because I'm busy fighting a fire. You're asking about a firefighter in the middle of a burning building, in the middle of a fire. What do you think about that guy across the street setting another fire? And I'm like, if they're going to make my life more difficult that I, have to fight another fire after this one's over, fine. That is what I signed up for. But don't be surprised if there'll be no one left to take care of you when it's your turn to get sick, if you're constantly exhausting us. But I will still go in no matter what. I will clean up the mess. I'm not complaining. But the fact of the matter is that if you're going to make my life more difficult by setting off more potential fires, there will be casualties. There have been casualties already. Doctors have died. I spent 2 hours looking for a consult in my shift on Tuesday, only to be told that the doctor died of COVID-19. That's why they're not calling back. And I'm like, really? Is this a sustainable healthcare system? If people are protesting because they want to reopen the economy, I ask you this: how are you going to have a developed country economy, what they want to call a first world economy, be sustainable and grow if the country has a healthcare system where half the doctors and nurses are injured, disabled, dead, or laid off? Right? You can't have a functioning economy with a broken, unsustainable healthcare system. And it's really trending that way. If I can't find a consult because they died from COVID-19 for 2 hours for a patient that was bleeding in her head, or people are dying in the waiting room. Last weekend, I had to resuscitate somebody who died in the waiting room. I mean, because the ER was too full. I mean, what's next? The street? We're having mass graves in Hart Island. We're laying off doctors and nurses elsewhere outside of New York City before the pandemic has hit them because we don't have enough. The hospitals didn't have enough money because they were told to not have elective surgeries. Well, guess what? The patients that needed those elective surgeries are probably the ones sick enough to die from COVID-19. So you're not going to get that money back, and you're laying them off. So what's going to happen to our livelihoods? Let alone, how do any of us will feel safe going back into work after the first 2, 3, 4 surges and waves? The healthcare system that can't work, you can't have economy. So good luck, but just try to think a little more long term.
Right. You brought up so many critical questions that we're all going to have to face once this crisis is over. And certainly we want to make sure that the soldiers on the front lines like you do remain healthy. So is there anything that we as a community can do to help you? And, or is there a certain type of help that you and other healthcare workers need at this point?
Get ready for that hashtag. Hashtag stay the fuck home. That's really it. If we can convince one person watching this right now, just one person who's debating whether to go to the emergency room for a test or work, or a med refill or just something, right? That may not be a life and limb threatening emergency. I get it. Like, the emergency room has been seen culturally as a catch-all place. And sometimes people nickname the everything room. I'm happy to take care of you, whether it's from toe pain to cardiac arrest. I've done it all. But if I can convince one of you to stay home just for one more day, you prevent infection and exposure to yourself. What if somebody coughed in front of your doorway in your foyer, 2 hours before? The virus lives in the air for up to 3 hours, especially without any airflow. So you can have caught it by just like breathing through the air as you're walking on, putting on your mask, right? Or you touch it on the subway, or somebody coughs in the back of your head as you're registering in the ER, or you get that test and then you get swabbed and then you feel great and you got swabbed and somebody sits down next to you and coughs in your face or coughs on your jacket, and then you get on the way back home, or your neighbor says, hello, how was your ER visit? And then gives it to you, or you give it to your neighbor. Although the people infected along the way, for the next 2 to 3 days before you get that result back, it's like, hey, you don't have coronavirus. You're negative. And then you get all excited for the false sense of reassurance because the test is only 70% sensitive anyway. So that means a 30% chance your negative test is wrong. And then you hug grandma and give her the virus, and then grandma's on life support 2 weeks later, 1 week later, and that's on you. That's why hashtag stay the fuck home is actually meaningful and has made a profound effect on emergency rooms this week and last week. We're finally decompressing and getting ready for the next surge. You are saving lives. After this pandemic, there's going to be another pandemic that we're going to have to watch carefully. So I'm concerned. However, I am also hopeful, as we said before, that any signs of trauma or tragedy, there is hopefully an opportunity for us to make things better and to look out for one another and to hopefully play more of a preventive role.
And this whole pandemic has certainly shined a bright spotlight on the inequities and the problems within our healthcare system. And I certainly hope that the community at large will rise up and demand from policymakers to take a strong look at this urgently, so that we can start making those fixes and providing some help, as you were talking about, for our healthcare workers, so that when this happens again, because it's not if, but when it happens again, that we will be more prepared at that time. Thank you so much. We are so incredibly grateful to you. Thank you for the critical work that you're doing on the front lines, and we just have mad respect. Wish you and your family continued safety.
Thank you. Thank you for having me.
The day we go out again, expect a bigger bounce back or surge, unless we figure out some way to stop the cycle.